This week on the podcast, we have Hannah Topp. Hannah is a women's health and pelvic physio in Sydney's eastern suburbs. She focuses on pre- and postnatal incontinence, pelvic organ prolapse, pelvic pain, and menopause. We had Hannah along to one of our eastern suburbs mothers group sessions, and she was such a wealth of knowledge. I learned so much in that hour and a half that I had no idea about before. I think there's such a gap in the market in understanding how women's health physios can support women through their entire lives. But I guess where we're focusing on is around pregnancy and the postpartum period. They can honestly just change your complete journey of pregnancy and your body throughout that period, preparing you for labor and birth, and then your recovery into postpartum. So we touch on all of that in this episode, how women's health physios can support you through that journey. But we also touch on perimenopausal, that period of our lives, and how women's health physios can support us through that period, because I feel like a lot of us are in the thick of postpartum or parenthood, and just around the corner when we finally come up for air, that is going to be the next thing to hit us. And it's one of those things, because we are kind of head down, bum up in parenthood at the moment. We're not really preparing for that stage of our lives. We don't really know what symptoms to look for and the way that it can affect us in our mood and our bodies. I just think, as much information as we can provide on that upfront now, so that we're prepared when it gets us in 5-10 years, is great. So we do touch on that towards the end of the episode, and all of Hannah's details are going to be in the show notes. So please have a look at her Instagram and her website. She's really brilliant. She was great to talk to, and we'll definitely be staying in touch and working together further along the track. Okay, good morning, Hannah.
Hi, how are you?
Good. Thank you for joining us today. I've just kind of given you a bit of an introduction so everyone knows kind of how we have come across each other. We were so grateful to have your time the other week for our mothers group. But do you want to just, for everyone listening, introduce yourself and kind of a bit about your business and what it is you do and where you operate out of?
Yep. Hi, everyone. My name is Hannah. I'm a women's health physiotherapist, and I have my own business called Physio Hannah. I work in the eastern suburbs at Bondi Junction Medical and Dental. So I just treat out of a room there, and I work at a clinic in Newtown as well. And I specialize in all things women's health. And yeah.
Yeah,
so I do it myself. I got into women's health physio from my own experiences when I was competing in powerlifting when I was younger, and I was deadlifting one day and just weed all over the platform and was really embarrassed, and I had no idea what was going on. So jumped onto Google, and this was before I became a physio. And then when I moved to Sydney to study my Masters of Physio, I was still competing in powerlifting, and I saw a women's health physio for the first time, and that's when my eyes were open to this world of women's health physio. And I thought this was just amazing, just such a wonderful and rewarding space, that I needed to be in this space because it really helped me and helped me in a time of such, taboo and embarrassing moments. So I knew quite early on in my physio career that I was going to specialize in women's health, because I just wanted to, share the message, talk about my experience, and help other women in the same position, and break the taboos and break the myths around like pelvic health and pelvic physio, and that it's not, you don't have to have kids for all these things to go wrong. And then even when you do have a baby, it doesn't mean you're going to have things go wrong, and things happen, and we feel symptoms, and we may have some signs of pelvic floor dysfunction, but it's a lot of the time it's very common and just not normal, and a lot of things can be done to help with it as well. So
what happened with what was the powerlifting injury? Like what caused that?
I think it was just general. It wasn't an injury per se. So powerlifting is squat, bench press, and deadlift. And the idea of powerlifting is you're lifting the most amount of weight as possible in one lift. And I think when you think about it now from knowing what I know now as a physio, I think back then it was just not awareness of the pelvic floor and lifting mechanics. And I guess, the bracing and breathing. But now what I understand is that it's the intra-abdominal pressure that builds up and then overloads the pelvic floor, and the pelvic floor muscles just didn't have the ability to match that pressure, which is essentially why anyone leaks, right? When we cough or sneeze, we're increasing the pressure inside our abdomen, and then our pelvic floor muscles can't match that pressure, and that's why we leak. So it basically, what was going on with me is, you apply it to a lot of people who leak with everyday activities. And so it wasn't necessarily an injury or a weakness. It was more coordination of the pelvic floor and retraining the coordination and probably strength. I didn't really have a strong pelvic floor when I first saw a women's health physio. But in saying that, I did get my pelvic floor very strong, and I did go on to continue to compete in powerlifting. And, I was deadlifting over 150 kilos and
Wow.
150 kilos. So to be able to go from like someone leaky on the platform lifting deadlifts and 100 kilos, 120 to then be competing at a high level. It was really just about the education and understanding about the mechanics of the pelvic floor and the mechanics of lifting and what that does to the pelvic floor.
Wow, that's such an interesting story as to how you got into it. That is, really interesting.
And I think that's what I love about it is it's such a personal experience as well. And I think, historically I was very embarrassed and ashamed to talk about it. But now that I'm in this space more, it's a way I connect with people and be like, hey, I really understand that, it's embarrassing and this is really crap to go through, but things can be done. And I think that's the most important thing is that it's so common. And, I don't have kids, and my pelvic floor was really bad, and now it's not bad at all. So, yes.
It's interesting. There are a lot of the experts that we have on the podcast and just chat to in general have gone into the women's health areas that they're in or women's support areas that they're in based off of their own personal experiences.
Mm-hmm.
It's really
the way we empathize, right? And I think as women in general and females, it's how we empathize and show compassion.
Yeah, and it's why everyone's so passionate about what they do as well.
Absolutely.
Which is lovely. Okay, so for those that don't know what when I was pregnant with my kids, I didn't know what a women's health physio was. I hadn't heard of the term, and a physio to me was kind of where you'd go if you had a sore back or so. And I do think the awareness around women's health physios and the importance of them and using them as a resource is growing, but I still think there is a large portion of people out there that don't really, they hear it kind of thrown around maybe, or they've never heard the term before. So why are you different to a normal physio? What are you focusing on and how can you help?
So as a women's health physio, or pelvic physio, as we're known as well, is we focus on anything to do with the pelvic floor. So that's anything in the pelvis, pelvic floor muscles, organs, fascia, joints. And I guess we're different because our assessments can be quite invasive. We do vaginal exams. That's part of our assessment. And that's kind of the thing that freaks people out a lot of the time when they get told to see us, and then they come in and then I'm like, okay, we're going to do an exam now. They're like, wait, what? I wasn't expecting this. So we specialize anything to do with the pelvis, pelvic floor. So that includes things like any pelvic floor dysfunction. So leaking, urgency, frequency, constantly rushing to the toilet, pelvic organ prolapse, any pelvic pain as well. So that can be pain with intercourse, endometriosis, vaginismus. And then we have pregnancy and postpartum, which is preparing for birth and labor, any muscle aches or pains during pregnancy, but then also postpartum. And then obviously doing the recovery and rehab postpartum as well. So that's sort of the gist of what we do. And an assessment, when you see a women's health physio, what your appointment will generally look like is taking a big history to understand your background and what you're seeing us for. And then we'll do a thorough assessment, and that sort of helps us guide the management plan going forward. And so I guess we differ from a normal physio in that we have had additional training to be a pelvic physio and specialize in the area. And then it can be a little bit more invasive as well compared to a normal physio. But yeah.
So during pregnancy, someone would come and see you at what stage usually? And would it be a proactive appointment or reacting to something that's happening?
It depends really. So during pregnancy, I mean, people usually come to us when there is something already wrong, or if they have a concern with something, which is fine because usually, I mean, I say everything we can treat everything basically. So you can come to us because there's a concern, or as a proactive measure as well. And what I really encourage women is to see a women's health physio after their 20-week scan, just to sort of get a baseline of where they're at so we can have a chat to them, have a chat about what they might want for a birth plan, have a chat about their current exercises, any injuries that we need to consider, but then also to do a pelvic floor assessment and understand where their pelvic floor is at, at 20 weeks. So then we can work out whether we need to change anything. And that could be like any pelvic floor muscle tightness, any weakness, or just even giving some education on, okay, these are the things to look out for during pregnancy. If you start to experience any of these symptoms, such as leaking or anything, then come back and see me. So generally I recommend, the first appointment early on as like a proactive measure. And then I recommend then at 34 weeks, I recommend a follow-up appointment for like birth preparation. So that can be things, preparing the body and mind for labor and delivery. And that's where we go more into teaching women how to push correctly, because a lot of women don't understand how to push, or when they think they're pushing, they're actually contracting their pelvic floor, which means their muscles are tightening, so therefore there's no space for bub to come out. So it can be making sure you've got good mechanics in like pushing or bearing down, is what we say, along with doing perineal massage and discussing other strategies to help prevent perineal tears or prevent the severity of tearing during labor and other obstetric anal sphincter injuries also. And then we go through positions for like the first and second stage of labor, along with some pain management strategies as well. So there's quite a lot we can do during that birth prep stage. So we generally recommend 34 weeks, and then again, probably 35 weeks. It's dependent on the person, dependent on the physio. Some women like to come in a little bit earlier, but I generally recommend it around the 34, 35 weeks. So then we can start with that birth prep as
Can
well.
you explain, when you came and spoke to us the other week, you were explaining that some people, so like when you're pregnant, blanket knowledge is usually start doing your, what do you call it? Yeah,
Kegels?
Kegels?
Squeeze,
Start strengthening everything up down there to help with labor and birth, but then also whatever's going to happen afterwards. And you were saying that sometimes that's not even the case. Like sometimes people are too tight, and that's prohibitive in other ways. So can you explain that a bit more? Because I think I'd never heard that before.
Yeah. So I think, I guess we get the advice to strengthen our pelvic floor muscles during pregnancy, and which is great because, I mean, majority of women do need to strengthen their pelvic floor muscles. However, what can happen if the pelvic floor muscles have a higher tone or tight, as we know, the muscles can sit a little bit higher in the pelvis, which means the pelvic floor muscles don't have the ability to relax very well. So then when someone's constantly trying to squeeze and do Kegels and strengthen their pelvic floor muscles can't contract well because they're already sitting quite high in the pelvis. So there's nowhere for them to contract and squeeze. And then therefore they don't have the ability to relax very well either. And it's a bit of a catch-22 really, because these women can come in and present with leaking when they're coughing or sneezing, and they're like, oh, my pelvic floor is really weak because I'm leaking. But then when I assess it, what's actually happening is their pelvic floor muscles are so tight and so like high tone that they're sitting in the sitting really high, that they just don't have the ability to relax their pelvic floor. So then we have the opposite problem of we need to teach women how to relax their pelvic floor, down train their muscles, so that they have the ability to correctly contract and relax, which then will help during birth and labor so that their pelvic floor muscles can relax. Because when we go into our second stage of labor and we do want to push out the baby, we need our pelvic floor muscles to have a lot of mobility and the ability to relax and then stretch and bear down to make space for bub to come out. So, and that's the other thing. I think it's not just assuming that your pelvic floor muscles are weak, because sometimes they're not. And we need to work on relaxing rather than strengthening.
And can you explain the perineal massage? So I have heard that this is what people do often seek out a pelvic physio for, is to help them work out how to do that and sometimes get it done for them. Can you explain? I'd never heard, again, it's a term I'd never heard of before. I mean, I never heard it with my first, I reckon. Can you explain what it is and why it's something that people would look to do?
Yep. So perineal tearing. So you've got the perineum, which is the space between the anus and the vagina. And when we have vaginal births, that the perineum can tear. There's 4 types of tearing. Grade 1 is just a graze of the skin generally. Grade 2 will go further into the muscle, and grade 3 and 4 they're a bit more severe ones. And I mean, they're relatively rare, but it's when they go towards the anal sphincter. And then if you get a really severe one, then it does require surgical review. So I'm just going to really stick to the 1st and 2nd degree because I don't want to scare too many mums out there with the 3rd and 4th. But what we want to try to do is prepare the perineum as best we can to prevent like the risk of tearing, or prevent the severity of their tearing as well. So at 34 weeks, generally we recommend starting the perineal massage. And what that massage, such a terrible word, massaging the perineum, but what we're trying to do is basically prepare the skin for birth. So we're trying to stretch out the skin, promote blood flow, and just create the mobility in that skin as well, in the perineum, and muscles as well. It is your pelvic floor muscles. So then we need to make sure that the woman can relax their pelvic floor muscles as well. Because if we're doing a massage and like stretching the skin out and they're just like tensing because it's so sore, then it's kind of counterintuitive. So we know that doing the perineal massage can actually shorten their 2nd stage of labor as well. And then it's not just about perineal massage. There's a lot of other things we can be doing as well during labor, during the 2nd stage, such as positions, warm compress on the perineum, like slowing the birth down if bub's coming really quickly, through positions as well, because that can help take some stress off the perineum also. So yeah, it's quite I think that's it. I think a lot of women don't know about it until it happens to them. And then, or unless they're talking to people about it, and then that's when they come see me and they're like, I just don't want to tear.
Everyone gets so scared about tearing. Like, I remember that was one of my biggest fears. But really what you don't do is can't do is put it into context of the situation that you're in and the amount of other things that are happening at that moment. And you think it's going to work up and be like this, like huge. But, with everything else that's happening, it's like, I mean, I tore and I think ended up with an episiotomy. And I didn't really know that it was happening because there are so many other overwhelming feelings in that moment. So.
Yeah, I think that's it. Like perineal tears,
people get so scared, but it's really not that scary.
Yeah, that's it. People get really like worked up over it and thinking it's the worst thing that can possibly happen. But and sure, don't get me wrong, like a 3rd or 4th degree tear is quite severe, but having the 2nd degree tearing, like it's still a tear, it's still a trauma, but that's it. It's so, depending on case by case, it's so, I don't want to downplay it by saying minor or insignificant, but a lot of people don't realize they've torn until, like the next day or something, or until they've had stitches. And it's more about, as women's health physios, we just try to give the education around what they can do to help prevent the severity of it as well. And, in my experience clinically, I see a lot of women who've had the 2nd degree tears, but then have had no concerns afterwards as well. And there's also things we can do postpartum if there is some scar tissue, or if there is some additional pain. There is some things we can do as women's health physios to help manage that also.
It's not as bad as it sounds in the moment.
That's it. And it is it's very much like it's individualized as well on how because everyone's birth's different, and that's it. Having a tear might be the most significant thing they experienced, and I think giving women the education, the awareness around it beforehand, and knowing that there's things they can do afterwards as well, I think is the best thing that we can be doing as women's health physios. And even when we have friends who are pregnant, just encouraging them to see a women's health physio during their pregnancy and postpartum as well.
Yeah, it's a bit like as well the build up to your first poo after birth. People get really stressed about that, but it's just something that you get through, and it's not as the anxiety around it is usually much worse than the women itself.
Yeah, that's definitely what I hear as well. And yeah, I think it's something like, yes, you have to do that. You have to have that first poo after.
You have to do it.
But to do. But that's also something that you can make it easier by making sure you've got good toileting and bowel habits as well, such as raising your feet when you are pooping on a stool or a squatty potty. And if someone does have a perineal tear or an episiotomy, applying some pressure over the perineum as they empty their bowels, so then the tissues aren't stretching as much, can help make that poop a little bit easier also.
Yeah. Okay, so then once the baby comes, so if you've seen someone during their pregnancy once or twice, and then they want to stay engaged after the bub's arrived, what and obviously what you do with them will be determined by the experience they've had maybe, but what might that postpartum support look like for someone?
So what I generally ask my clients to do is to come in at their 6 weeks postpartum, give or take a couple of weeks. So generally 6 weeks is when they come in, and we basically just have a chat about their birth story, hear how their labor was, and just hold space for them to talk about it, because it might be the first time they're really talking about it with someone apart from their GP or OB. So we talk about that and then go through any concerns they might be having. So are they feeling any heaviness in the vaginal area? Did they have a tear? Is there any aches and pains? And then we discuss their goals of what they want to get back to, whether that's, just getting back into walking, or, if it's like an athlete doing CrossFit and they're like, I want to go back to CrossFit. We talk about what goals they have and what their plan might look like. And then we do a pelvic floor assessment again to make sure, just to assess where they are now. We've assessed their pelvic floor during pregnancy, and their pelvic floor during pregnancy is going to be quite different to postpartum. And so we're assessing, looking at the skin quality, the skin tissue, especially if they've had an episiotomy or a perineal tear, and then assessing the pelvic floor function. Is it strong? Can they hold it for a long time? What's their coordination doing? Is there a lot of movement in their pelvic walls, in their pelvic floor muscles, or the walls of the vagina as well? And then also assessing their abdominal wall for abdominal separation, if that's a concern for them. And even if a woman's had a cesarean section as well, I really encourage a 6-week check, because just because you've had a cesarean doesn't mean you're immune from all the pelvic floor dysfunction that some women experience as well. So same with a cesarean, same sort of process. We do a pelvic floor assessment and then check their scar as well. And I start women on doing some scar massage for their C-section scar, because that can help with reducing any hypersensitivity, and it can help with pain management as well. So then we do that, and then we talk about a plan to return to what they want to return to. And then sometimes I might see women at their 6-week check, and that's all I need to see them for. Sometimes I'll get them back, depending once again on their situation and what is actually happening. I'll get them back again, maybe once or twice. It really just depends on what their goals are and what they want to achieve, and what we need to work on in terms of pelvic floor as well. And then the other thing that women see me for postpartum is any aches and pains that they might have. So the most common ones we see is mum's thumb, where it's the side of their thumb is quite sore from holding bub, often on their hip, and then as bub grows, the tendon's being strained. So then you get it's in this part of the thumb. And then it's also known mum's thumb, or de Quervain's is the most common thing I see mums for postpartum. But
so the mum's thumb is so common. I know both of my sisters had it bad enough to get a brace, I think.
Yeah.
What can you do you can't really prevent it, can you?
I mean, you can make sure you're just swapping arms that you're holding bub in, doing you can do like some strengthening exercises as well. So what I usually get mums to do is pop like a band like around their fingers. I don't know if it's being filmed, but I'll show with my hands anyway. But popping like a hairband like around the top of their fingers and then opening up their hands, because that can actually add a bit of resistance and strengthen that tendon as well. But once again, it's really dependent on how it's happened and what if they've had injuries before. But the most common thing I generally do is taping is the first thing I do, because then at least they can understand, okay, if taping is helping me, then a brace might help, and then potentially ordering a brace. And the braces that I get, they're not like you just wear them throughout the day. They don't interfere with, they don't stop you from being able to hold bub or pick bub up as well. So we want something that that mums are going to be compliant with, that's not going to interfere with their day-to-day activities. And then strengthening through the wrist and tendons also. But it's super common, and I think there's a lot that physio can do to help it, and I would encourage women to come to a physio first for this, because I do know that a lot of GPs will send them straight for like cortisone injections, which long term might not be that beneficial.
And then I didn't know this until quite recently, but people can come and see you if they feel like they're getting mastitis. Is that right?
Yes, that's correct. So mastitis, as we know, can happen because like you're producing too much milk, also known as engorgement, or if there's just blocked milk ducts. And we know that mastitis starts off as non-infective. So often women will generally feel a lump initially, and it always starts off as non-infective. So if you can get on top of it quickly after you feel that first lump, then generally you can prevent an infection from coming. But then we also know that the infections can come on very quickly as well. So like your symptoms of mastitis is like flu-like symptoms, fever, just feeling really run down. Obviously you notice like if there's any redness on their breast as well, like the red, like warm lump is generally a sign of the infection. But what we can do as women's health physios is we can help with some massage techniques and teaching mums how to do them for themselves as well. Just general advice around like feeding positions. And then a thing that I've also found that works quite well clinically is taping. And I know it sounds really strange, but the stretchy K-tape can actually help mums, like especially if they've got a lot of milk and they're producing a lot of milk and feeling quite engorged and heavy, and then wearing a bra is quite painful. Taping can also like help alleviate that, I guess, that heaviness. But then the biggest thing that we do is using ultrasound, like therapeutic ultrasound, which can help free up those milk ducts and help with the pain and discomfort associated with a non-infective mastitis.
Not the ultrasound, not the ultrasound that you're getting while you're pregnant.
No, it's
what's this? How does it work?
It's a therapeutic ultrasound, and a lot of physios, like physios have historically used them as well as like a way of treating like tendons and muscles. And what it does, I hope I don't get this wrong, it's been a while since I've used an ultrasound. It produces like sound frequencies, sound waves, that help with the breaking up the duct, and like freeing it up with like freeing up the milk duct, so breaking down that like lump of milk and infection and like glugginess, if that makes sense. It was the most non-scientific way I've explained that. But and I'm not quite sure of the evidence currently, but I know that it just works a treat in clinic. And I had one woman a few years ago come see me when their baby was 8 weeks old, and their goal was to breastfeed until Bub was 6 months. And I know initially like they were coming in every second day just for some ultrasound treatment, and then it was like once a week, and then once a fortnight even. And then I got a gift box at work when she was 6 months saying, "We breastfed until 6 months, all because of you." And I think whilst a lot of it is the ultrasound, a lot of it is like the education and some strategies that mums can use at home to help manage that as well. So, that can be, massaging. If they have engorged breasts, just even hand expressing just the tiniest little bit just to relieve a bit of that pain. Like you don't want to hand express to get rid of milk, because then you're just going to produce more milk. So then you're going to be more engorged. Using ice or ice pack when you're not feeding, and then using a heat before feeding to help the flow of milk as well.
Yeah, we've just done the birth course, and the postpartum course is actually coming out this afternoon.
Oh, amazing.
And we built it with Ricky, who's a doula, and Kathy, who is a midwife and lactation consultant. And both of them are huge advocates for women's health physios. But it's Kathy that, when we're writing the course, that I think she put it in the mastitis section. It was to see before you look at antibiotics, to go and see a women's health physio for the ultrasound. And I think that's the first time I'd even known that it was an option. Like, people are just straight to the antibiotics, right?
Exactly. And a lot of the time, it's antibiotics, and it's often like when they feel the lump, they go straight to the GP and it's antibiotics. But then if there's no infection, if it's non-infective mastitis, then the antibiotics aren't going to help. And then, it'll help prevent infection, but it's not really going to help solve, the clogged milk ducts.
Yeah. Do people need to get a referral to see you?
Not at all. So women can come see me without a GP referral, or anything really. Even if you think you might need, I don't know, a GP down the line, like, you can always come see the women's health physio first, so we can do an assessment and discuss whatever might be concerning you. And then, and then I often tell women whether they do need to go back to see a GP or not, or whether we need to, like, how we can manage things, if it's something that we can just manage conservatively without a GP or a gynae. But yeah, no one needs a referral to see me. They can just book in online and show up.
This episode of the podcast is sponsored by our sister brand, our new business venture called the Parenthood Society. We're a few years into running the whole Bolco now, and Daisy and I aren't quite convinced enough is being done to support new parents during their transition to parenthood. Birth and postpartum education seems slightly outdated and hard to access, and the corporate world does next to nothing to support new parents in the workplace, their transition to parental leave, and a successful transition back from parental leave. Also supporting a partner in the workplace while the primary caregiver is on that parental leave. We feel like there's a bit lacking there. Not many expectant parents know what support is out there for them and how they can access it. It created a bit of a fire in our belly to create better outcomes for new parents across Australia. And so we've joined forces with a couple of powerhouse women in the postpartum and women's health space. We've got Kathy Short from Milk and Mums Co. and Ricky from the Doula Pod. And these guys are experts in their fields. And together with them, we've created the Parenthood Society. And at the Parenthood Society, we offer online courses. So we've got a Prepare to Birth course and a Prepare for Postpartum course that also includes a large infant care section. So these are accessible online. And then we've also got monthly face-to-face birth classes in Maroubra and Miranda in Sydney. So stay tuned on that. Well, don't stay tuned. Jump on the website. Have a look, guys. Check out the Instagram. Follow along. It's live. It's ready to access now. And we've put a lot of blood, sweat and tears into it over the last few months to bring it to life. And it's there. It's launched. It's like birthing a new baby, and it's out into the world. We've also created a transition to parenthood corporate program to support employees in the workplace. So this is also being rolled out at the moment. So if you're interested in getting access to that information, please send us an email or a DM and we can get that into your hands. But yeah, follow along for all of our new initiatives under the Parenthood Society.
Good.
And then after this lovely stage of that most of our audience are in, the postpartum period, that I say is about 7 years. And then we enter the next stage of our lovely female journey, which is the perimenopause stage, right?
Correct. Yeah.
And you see women throughout, you see women through every stage, but I think this is one that a lot of us, by the time we're out of this period and can take a breath, we're going to be bloody entering into that one. And so I just wanted to understand when people see you during that stage, how you can help them through that period, when that period is. Like, I feel like a lot of us are closing our eyes to it because our mental loads are heavy enough at the moment, but it's it is just around the corner. So can you tell us a bit about it and when to expect it and how you help women?
So the lovely M word, menopause, right? I mean, it's a bit of a hot topic at the moment, I think, with a lot of inquiries going on. And I think, once again, it's something that women don't think that they can see a women's health physio for. And I think, it's really like, it's really a multidisciplinary team that does help manage menopause and perimenopause as well. So I guess let's start off with what perimenopause is, first of all. So perimenopause is when you start to get irregular cycle changes. So that could be your period is shortened, like is starting to shorten. So it's only 2 days instead of 6 days, or it's longer, or the flow changes, in conjunction with other symptoms that we typically know are part of menopause, like hot flushes, trouble sleeping, anxiety, like even social anxiety, feeling of just absolutely losing their marbles.
Not too dissimilar to postpartum, really.
Exactly. And that's the thing. A lot of these symptoms are very, that's it. Like if mom, if someone's just had a baby a couple of years ago and then they start having these, then it's like, oh, are they just going through a phase? And
Yeah.
I think the thing is, I think as well, like a lot of women, because their symptoms change from person to person, and they can just be so different from person to person as well. So often it's like the sleeping, the feeling anxious, the heart palpitations. They'll go to the doctor and the doctor's like, oh, you just got anxiety, here, take some medication. And then I think that's where a lot of women do get missed in that perimenopausal phase. So I think being aware of these symptoms and really understanding what might be going on with your body is,
because so many have got like IUD, and you're like, I wouldn't know if my cycles were changing or
that's the other thing is, but IUD, the pill, it's hard to know whether things are changing initially. So it's like all these, what other symptoms is there, and is it a sign that you might be in perimenopause? So the perimenopause can go, once again, it varies from women, but like even like 2 to 10 years, like it really can change. Like some women can be perimenopausal for quite a while. Some women don't have, like some women might, their periods might just stop one day and they're like, oh, I guess I'm menopause. And so it's really just dependent, and it can also depend on, like, your mum and grandma and how they went through menopause as well. And then, so perimenopause, this stage of when you start getting irregular changes, noticing these other symptoms, right until the day of the final period. And then menopause is that one day of your last period. That's one day, that's menopause. The day after that, you're post-menopause. So,
okay.
and we classify this whole thing as, going through menopause, right? But that's the definitions of it. Perimenopause is the time leading up to your last period. And then you've got menopause, which is one day, and then postmenopausal as well. And then during that time, we get a lot of hormonal changes. And the big one we see, and the reason I see a lot of women during perimenopause, is the changes of estrogen levels. So the estrogen levels are constantly fluctuating through perimenopause, but, gradually declining. And then low estrogen levels can lead to, vaginal dryness, like skin irritation, itchiness, redness, which then can lead to feelings of like urgency, frequency, a lot of like UTI symptoms. That's related to the estrogen changes. It's causing the skin to feel like dry, and the skin like thins out as well. So that can increase those symptoms and exacerbate those symptoms. But not only that, because of the estrogen changes as well, that does affect our tissue health. So the skin, like the skin and like the muscles, that tissue health declines as well. So we get some muscle atrophy or muscle wastage during that time. And then once again, that can contribute to symptoms of leaking and incontinence. And then, things like pelvic organ prolapse, which is when you get the descent of the pelvic organs, which can give those symptoms of heaviness and dragging. And so that's when I see a lot of women, as if they're getting any of those symptoms. And then generally what we work on is your pelvic floor training. And a lot of it is also just education. And then along with management with the GP, is generally using some sort of like estrogen cream or a topical cream to use to help with that tissue health. And even just giving back the tissues the estrogen that they've lost, that can basically solve someone's symptoms as well. I think another big one is perimenopause is getting pain with intercourse as well because of the tissue health. The tissue health has declined because of the estrogen. So then that can give feelings of like discomfort and like almost like burning, stinging type pain during intercourse. And but yeah, sorry. No, that was me. I'm so sorry. I don't know how to. Sorry. Let's quit this and hope that it doesn't.
As it's stinging, my phone's flashing, so I was like,
Oh, okay.
Can you put
No, so it was my message coming through my laptop, and I don't.
That's okay. I can delete that bit out. That's fine.
And so where was it? Yeah, so it's really like the changes in estrogen can cause all these like symptoms, like pelvic health symptoms and pelvic floor dysfunction, as to why people will come see me as well. And then
And when that perimenopause, so it could be 2 to 10 years, but when can it kick? Like, I know it changes for every person, but when does it usually kick off age-wise?
generally, like clinically, from what I've seen, like mid to late 40s. Like the average age for menopause in Australia is 51, 52. So, you know, the few years before that, really. So around, 45, 46. Once again, it really just varies. I've known women to be in perimenopause in their late 30s. And yeah, so it really,
and during that period, so like, what if you're on birth control the whole time and then you never even know what your menopause date is?
You might just come off birth control and not have a period. That could potentially be one. I mean, that's if there's no other symptoms. Like, you know, a lot of the time it is associated with other symptoms as well, like, you know, mood changes, like your heart palpitations, like rapid heartbeat, those things, like, you know, your hot flushes is a typical menopause symptom that we hear women talking about. So that you can get those symptoms and still, like, you know, whilst on birth control, and then, like, you know, on the pill or the Mirena and not have a period, and then you might just come off it and just never get your period back. Then that would be, you know, given around the age and stuff, that would be a sign of, like, you know, being postmenopausal if you don't, like, if you've come off birth control and you're around that age, and just don't get your period back. I think the other thing I want to say is, as well, is a lot of women think like, I'll just go get a blood test to check my hormones and see if I'm in perimenopause, and having blood tests isn't an accurate way to tell whether you're in perimenopause or not, because the hormone levels are constantly fluctuating. So you could get a blood test in the morning and that will be different to the same person getting a blood test in the afternoon. It's not necessarily an accurate way to like find out whether you're going through perimenopause or not. So generally, you know, a lot of women come in and I have a lot of chats with women about, have you considered that you might be going through perimenopause? And a lot of it is symptom-based. You know, it's often symptom-based to diagnose it. And then that's when I'd recommend having a really good GP who understands menopause. And then I work closely then with the GP and the client to form out, okay, how are we going to treat this? How are we going to manage this? Not so much you're not treating menopause, you're managing menopause. And that can be, you know, through like holistic therapies, like, you know, your acupuncturist, naturopath, or then, you know, using like hormonal replacement therapy as well, which I know is a bit of a touchy subject for some women, but like that is the best way to manage it, because essentially you're just giving your tissues and your body back the hormones that it doesn't have. And that if that just helps someone function and gets through life a little bit easier, then why not do it?
Does that help with the mood stuff as well, like the anxiety?
Yeah, absolutely. And that's a thing that I see a lot of is, you know, women, they go to their doctor and, you know, I say they've been a bit anxious, having mood changes, not being able to sleep. They think they're literally just going crazy. And a lot of them are put on, you know, antidepressants, or being like, oh, here, go see a psychologist, when really they need to be on some sort of hormone replacement therapy or HRT, because giving someone back those hormones it just balances it a little bit better so that they can manage their anxiety and mood, and just it makes it easier for them to just get through the day. And I know there's a lot of research coming out lately about hormone replacement therapy and managing the symptoms of menopause. And I think, it's something people should consider if they are going through that time as well. And like I said, it really is that multidisciplinary team managing this, like with the GP, women's health physio, but even psychologists need to be aware of it as well, if they're seeing someone around this age that's coming in with, this sudden onset of mental health. Yeah.
Red flag, yeah.
Yeah.
It's so interesting that, some people don't get symptoms, but a lot of people would just get through that 10, 20 years with like just getting on with it, right? And
Yeah.
not putting it down to being or menopause, and even if they had put it down to being menopause, not understanding what's available to help them
That's it. I think
get through the period.
people just think they just need to push through these things because we're female, and like there's not a lot of research out now, but there is so much being done to help us understand more about what we can do during this time. And I think, just because we are women doesn't mean we have to put up with going like, losing our marbles in our mid to late 40s. And then, in saying that, some women like go through it absolutely fine and have no issues whatsoever. And then, I'll see them postmenopausal and they're like, oh yeah, I didn't even know my period's just stopped and now I'm here. And I'm like, oh, okay, that's great. But yeah, and so I think it's just being aware of symptoms. The Jean Hale's website has a checklist for perimenopause. Jean Hale's, I'll send a link, flick a link over.
Yeah.
But it has like a little symptom checklist to check whether symptoms, like what symptoms of menopause are most common, and it's something you can print out and fill out and then take it to your GP as well. That's usually a good tool for helping diagnose perimenopause. And then I do want to just add as well, this is a bit of a kind of a tangent, but it goes to low estrogen and just back to postpartum mums as well. So when mums are breastfeeding, we actually do get a drop of estrogen levels during that early postpartum stage and while they're breastfeeding. And that can actually give mums symptoms of burning and stinging in the vaginal area around the skin, the entrance to the vagina, which then can lead to painful intercourse, more symptoms of like urgency, frequency. So that's the thing I see a lot of women as well postpartum. They'll come into me and they're like, oh, it hurts when I have sex, but it never hurt like when I was pregnant. And then when I do the assessments, I can see that there is some redness in the tissue, and it doesn't necessarily feel dry as such, but you can just tell the difference. And I'm like, oh, you still breastfeeding? And often it's yes. And then they present then with the same symptoms because of their low estrogen. And there was a new term that's recently come out. It's called the genitourinary syndrome of breastfeeding, I want to say. I don't know if that's right, but there's genitourinary syndrome of menopause, which is the things we just spoke about, or the pelvic floor dysfunction of menopause. And then one has come out as well, genitourinary syndrome of postpartum or breastfeeding. I can't remember the top of my head, but it's known, they're actually recognizing it as a condition postpartum due to the low estrogen as well. And generally what we do with that is, pelvic floor training can help, but it might just be as simple as getting some topical estrogen cream from the GP as well.
Yeah, wow, amazing.
To sort of link that.
Do you ever wonder in your field how different things would be if these were male health issues?
All the time. Like I have this conversation with a lot of women, and yeah, like that's it. Like if this was a men's problem, like, we would have so much more evidence and
government funded.
Yeah, exactly.
Government funded solutions. There'd be fucking billboards everywhere. There'd be
exactly. And I was listening to this podcast ages ago, and they were talking about they linked it. There was just like a fun fact of linking like the hysterectomy to giving women like this, like going like old ages, like getting women to have a hysterectomy because they're basically hysteric. Like hysteria means they're going crazy, and so they'd go through these like crazy times and have like hysterectomies to try and manage their craziness. And you look back once again to like also like so many years ago that meant the women, like so many more women were just put into like mental institutes around this time because they were going through this stage, and no one knew what was going on. Everyone just thought the women were turning crazy. And
oh my gosh,
it's not like, it's just not like, it's really it's hormonal changes. And I think it's so like, it's just so important to have this conversation because it's so taboo, and it's so, people don't talk about it, and we need to be talking about it a lot more. But these hormonal changes, but then these hormonal changes are also happening in this early stage postpartum as well, which I think is important to address. Yeah.
And our mother's generation did still just get on with this stuff. I think they're a bit better about probably seeking help and understanding what's available for them. But I think, this generation now is, it's up to us to look at our friends and our sisters and whatever, and maybe be like, you are acting like you are losing your marbles a bit, but have you thought of this? That midlife crisis for women, something to keep an eye on, and make sure that they're aware of what they might be going through and the solutions available to them, because
and that's it.
When everyone's just labelled as going crazy, do we?
Yeah, that's it. Yeah, it's like having this conversation with friends, and even sharing experience about, I guess, seeing women's health physio. I had a woman come in the other week and she goes, "Oh, you've helped me so much. I've told so many of my friends about you that have the same problem as me." And it's sharing that with them. And even if they don't share the full story, it's oh, you've got that problem, go see this person because they helped me. Yeah. And I think that's really important as, women in, starting from our mum's group. But even then before that, my story with having so many issues with me and lifting, bringing that awareness to women and just opening the conversation that we can do things to help each other and help yourselves, and you don't have to, be walking around wearing pads because you're worried you're going to leak, continuing exercise. You don't have to stop exercise just because you have a prolapse, or you don't have to stop doing something you love doing because of the limitations of these pelvic floor issues. There's just so much that could be done, and it's just, I guess, it's creating that awareness that there is something out there. Yeah.
Amazing. Well, thank you. Thank you for this discussion. I've gotten a lot out of it, and I think a lot of other people will as well. Is there anything before we wrap up that we didn't cover that you think should be?
I don't think so. I do want to just go back to women during pregnancy as well, because I talked a lot about preventative, coming in as a proactive type thing. That if there is obviously concerns during pregnancy in terms of pelvic floor dysfunction, your leaking, your heaviness, any low back, hip pain, that's obviously come in. You don't just have to come in at that 20 weeks and nothing until 34 weeks. You can come in if there is other concerns as well. And I think that's a very common thing I see a lot of women with is that low back pain during pregnancy. There's a lot we can do as women's health physios, because it could be coming from the pelvic floor muscles. It could be simple as doing, once again, educating, giving someone a support belt to wear, to help get through their day when they're walking down hills or something. So I think that's the other thing is, if there is any concerns to do with aches, pains, body, definitely see a women's health physio during pregnancy for that also.
Yeah, amazing. All right, lovely. Thank you so much for your time today.
Thank you so much for having me. I've really enjoyed this. I hope you'll have me back one day.
It is so lovely. Okay, thank you very much. All right, I'm just going to stop recording. We really hope you guys enjoyed that episode with Hannah. I certainly enjoyed recording it with her. Final notes from me is that we have launched our Mothers Group program for the Sutherland Shire. This is being held at Bay Central in Woolooware, and it is a free program because we are doing it in collaboration with Bay Central, which is amazing. The lineup of speakers every week, we've got the Doula Pod, Milk and Mums Co, Nourishing Bubs is there, Completely Baby, 10 weeks of absolute amazing experts coming to provide us with information over the hour and a half session. Each week we'll be giving away goodie bags with discount codes and samples. 15 mums at every week. When it's booked out for that week, it's booked out. We're releasing tickets 2 weeks in advance, but as I said, it is a free session. You just jump on to secure your spot. So I will link that in the bio. It kicks off on the 8th of October, and then we're running it for 10 weeks. So if you're in that area, or if you're in Sydney and you don't mind a bit of a road trip with the baby, jump on board because it's going to be amazing and we can't wait.